Hello, I'm Amanda Walker and welcome to Inside America, the show that brings you insight and analysis of the biggest issues facing the United States right now. In this episode, it's expensive, complicated and dysfunctional. Today, we explore America's failing healthcare system. The price of getting sick is a massive burden for millions of Americans who pay more for their healthcare than anyone else in the world. But almost half of them can't afford it. Medical bills remain a top financial worry for families. Many of them are crushed by debt. The killing of United Healthcare's CEO reignited debate over a system that's widely seen as failing the people it's supposed to serve. Coming up, we hear from a man who became paralyzed after his insurance company stopped his medication.
Hey, you don't need this anymore because we want to keep our money.
And we look into why so many Americans find themselves in severe debt.
Any medical service that you receive in the United States is an opportunity, unfortunately, for predatory medical billing.
So, day one of the second Donald Trump presidency saw a flurry of executive orders, and healthcare was one of the issues where he put his pen to action. He reversed a number of Biden-era efforts, for example, lowering prescription prices for people on low incomes, but notably left intact some major policies, such as Biden's $35 monthly cap on insulin. And despite the US spending more on health over the last 50 years, nearly half of Americans are skeptical that lawmakers will practice what they preach and lower the cost of healthcare. In addition, millions of Americans face debt and insurance obstacles, which can lead to essential treatment or medication being denied. There are millions of stories out there. I went to meet one man who told me his. Michael was a satellite engineer in the Air Force. Now, delivering food for DoorDash is as much as his condition will allow him to do. For a months-long period, he couldn't even do that, and it was entirely avoidable.
I was first diagnosed with multiple sclerosis back in 2011, January 26th to be exact. I went to the hospital, eyesight was messed up, I was dizzy, couldn't keep my balance and everything like that. And the initial thought of it was like probably Bell palsy or something like that. They gave me an MRI and everything. And the doctor said, initially, I really think this is MS. Take about 4 pills every day. Mm-hmm.
After the initial shock, he learned to live with his condition, thanks to his medication. Holding on to that has become his main fight. You were on a medication that was doing great for you.
It was doing very great.
And the health insurance company decided because of that, you should stop taking it.
That's correct.
Is that how it works with MS?
That's not how it works with MS. MS is basically, as of right now, there's no cure. For me, it was like I was on Tisabri, it was doing well, then they took me off of it. 3 months later, I had a relapse.
And what did that look like for you?
For me, at that time frame, it was basically eyesight was gone again. Basically balance was gone again. Functionality was so I was pretty much homebound. Couldn't do anything too much.
Could you walk?
I mean, if I did, I would just be like bouncing off walls or anything, or looking for support on something.
So you couldn't work?
Yes, it couldn't work.
So you had 4 months of effectively your body being paralyzed because they denied this drug. What was going through your mind?
Oh, that's horrible to me. It's just like somebody who doesn't know the issues, or they're doing things to help their situation, is kind of disconcerting to me. It's like, my whole thing is like the whole health industry should be just like, we're here to help you. This is what we do. But then becomes a problem when money is involved.
So what's been worse for you, your fight with MS or your fight with the insurance companies?
I would think mostly insurance company, because the MS, I have a great team behind me to help me manage everything, even when the insurance companies decide to not play ball. I'll have my
That's
family.
quite something to say, isn't it? That
Right.
the very serious condition that you have pales in comparison to the battle with insurance companies.
Right. But as I said, my support system is doing much more better for me than the insurance company, which is kind of saying a lot. It's hey, all we want to do is people want to get better.
So is this how you decompress, Michael, when all of it gets too much?
Yes. But sometimes it can be stressful itself.
For the moment, Michael feels able to live his life, but it's precarious.
Right now, I'm on a good path thanks to people helping me out. But anytime the insurance company decides I can be on Ocrevus, that's the new drug I'm going to go on, I can be on that for a little bit, and then all of a sudden, you're doing fine, don't need it anymore.
Is that stressful?
It's very stressful. For me, it's definitely stressful. But it's my doctor he's like, I just don't get it. We suggest it, yet they don't want to listen to us.
Michael mentioned it there. The biggest criticism against healthcare in America is that the system is designed to make profit, which immediately creates reluctance to pay for the highest level of care. Let's get an insider's perspective on the health insurance system from a former executive. Dr. Virgie Bright Ellington is an internal medicine physician and medical billing expert. She's author of the books Crush Medical Debt and What Your Doctor Wants You to Know. I asked her what she sees as the root of the problem.
It's frankly illegal, if you think about it, for a publicly traded health insurance company to provide all of the care that a person needs, that a member, that's what we call a patient who's covered by that particular insurance company. If you think about it, it's illegal for them to do quote unquote the right thing, meaning if there's the best care for them is for a patient is something that's more on the expensive side, the company is actually going to have barriers in place called policies that will limit paying out for that care.
Because that lessens profit.
That lessens that eats profit, and therefore you're saying, okay, yeah, it's illegal for us to cover 100% of what your needs are. This is what we're saying to our members as a publicly traded health insurance company.
So, of course, no one should condone the killing of company executives, but there are private tragedies happening out there every day. What stories in particular have stayed with you?
You know, I had been an internal medicine physician for 25 years, and I'd been a health insurance executive for a decade. But it wasn't until I became a patient and met my hospital roommate, who I figured out within talking with her instantly, within an hour of conversation and meeting her, that she had been taken advantage of by the hospital, by the billing department. And she had been tricked into signing an agreement that she would pay whatever her insurance doesn't pay. And without going into details, Amanda, it's a form of what's called balanced billing. And we can talk about that, some other time. It's a small detail, but an example of why you have to have medical financial literacy. Otherwise, you'll be taken advantage of. You and your family could face disaster. So this young mom, a very young toddler, so she wasn't able to work outside the home yet. And her insurance was from her husband's work at a 24-hour diner. So very modest income, right? And I knew instantly that she had signed away basically her family's future.
And do you mind sharing your own experience with cancer and what that did to you financially? Were you as aware then as you are now?
Oh, definitely. So my hospital visit was an emergency surgery that was a complication from one of my cancer surgeries. And fast forward, I leave the hospital, fast forward, Amanda, 6 months later, I get a bill from that same hospital attempting to balance bill me to the tune of $90,000. It was almost a $90,000 bill. That was just, I knew it was a balance bill. And I thought, wow, if I didn't have this knowledge, this basic medical financial literacy, I would be in debt. I'd be paying
Right,
this
and
off
most
forever.
people's first thought would be, oh my gosh, how am I going to pay this? Let's raid the savings. I need to pay this or I'll be in trouble. What did you do?
Well, first, actually, I called my insurance company just to see if they had gotten what bill or claim they had gotten from the provider. And the insurance company said, yeah, we got a bill from them for approximately about $90,000. And it was the same number basically that they were billing me. What I call, playing two sides against the middle. They were trying to double dip, right? So I said, okay, thank you very much. And they shared the number that they paid. Okay. So I called the billing department of the hospital and I said, yeah, hey, I got this bill for almost $90,000. And, what can you tell me about this? And the person said, wow, you know what? $90,000, that's a lot of money. You can't be expected to pay that all at once. How about if I transfer you to one of our team members? They can help you make a payment plan. And I said, no, thank you. And I hung up because I knew I didn't owe that money. And I never heard from them again, Amanda.
But you could have paid it and they would have accepted it.
Oh, definitely. Definitely. And do you think you would have known they wouldn't have given it back?
How would you describe getting sick in America?
Risky. You're risking your financial future forever. You're risking you have no financial stability if you don't have basic medical financial literacy to be able to say medical financial literacy to be able to say, okay, this is what I'm going to do to protect myself from a catastrophic medical event.
Are you surprised, given how much this affects people, that it isn't more of a political issue? We don't really hear about this in election campaigns. Why is that?
Because people don't know what they don't know. People don't know that they're being taken advantage of. We love our nurses and we really appreciate our docs. The point is they have no idea what's going on in the back office, in the business office. It's two completely different universes. And I have to tell you, if physicians knew what was being done, what was being billed in their name and being done to their patients, the stress that financial stress that's caused by huge medical bills that many don't owe, they would be outraged. It's just people don't know that, hey, you guys are being taken advantage of. So 80% of every single medical bill in the United States, Amanda, have mistakes. They're wrong. So there is a way for health insurance companies to make a fair profit. This is not going to happen if we don't discuss it as an option, right? So
do you see anything happening under the Trump administration?
that's the big question. So what's called the CFPB, the Consumer Financial Protection Bureau, has come out to say, you know what, we're going to say all medical bills cannot be reported to credit agencies so it doesn't hit your credit score, which is a big weapon that the collectors would use to force people to pay whether they owed it or not. Oh, the bills are rightfully, accurately or not. The outgoing Biden administration said, hey, we're going to have the CFPB, the Consumer Financial Protection Bureau, have this as a nationwide law, period. Essentially, Amanda, they are daring the incoming Trump administration to say, hey, this is a very popular federal law that we've enacted. Let's see what you're going to do about it. Do you have the ability to say, okay, we don't care about the constituents and how they feel about it, this popular law. And he's considered a populist politician, a populist president. So that remains to be seen.
So Dr. Virgie Bright Ellington there talking about the push for profits being counter to providing the best possible care. In an op-ed for the New York Times, United Health Group Chief Executive Andrew Whitty wrote, "We know the health system does not work as well as it should, and we understand people's frustrations with it. No one would design a system like the one we have, and no one did. It's a patchwork built over decades. Our mission is to help make it work better." So when you look at all the issues we've explored so far, you might wonder why this wasn't a bigger issue on the political campaign trail. Joining us to discuss that and more is Joyce Frieden, who is Washington editor of MedPage Today, and political strategist Rina Shah. Joyce, let me start with you. Let's address that quote from the United boss. Our mission is to help make it work better. Any evidence of that?
Well, the United boss did recently announce that his company was going to be making some changes to try to make things easier for the people they insure to get tests and procedures done, to cut some of the red tape, but it's only going to be for some of the people they insure, the ones on the Medicare program for mostly for seniors. So there aren't really any other indications that the system is going to change much at all.
So, Rina, on the campaign trail, immigration, inflation, the big issues being talked about, but healthcare wasn't really up there. Are people just resigned to the fact that this is not good and they just should accept that?
Usually I find that healthcare policy is one of the top 3 issues during any campaign cycle when we particularly look at the past 10 to 15 years. In particular, Republicans have always used repeal and replace Obamacare since the passage of the Affordable Care Act. Back in 2008, what I think we saw from Republicans was a rhetoric that government shouldn't be involved in healthcare decisions, that should be between a person and their physician. Now you see today's Republican Party flip that script. In the aftermath of the decision of Roe versus Wade being overturned by the Supreme Court, what we heard socially conservative Republicans say is that we are fine with bureaucrats actually making reproductive care access decisions for women across the country. But now we know the states are doing that. So back to healthcare policy as this sort of big issue. It wasn't even in the top 3 this time because I would submit to you it was sort of eclipsed by geopolitical tension. Healthcare also is very much not seen as a right by everybody across the country.
And when you look at the last big reform, the Affordable Care Act, Obamacare, just remind us, Joyce, what that is and why it became so controversial and became this real political weapon.
Sure. So the Affordable Care Act was passed in 2010 in the Obama administration. And basically, it was trying to make it easier for people of less means to get health care. So they set up a system where you could buy private health insurance plans at hopefully at a lower price. And they also did a few other things, like said that the insurance companies could not discriminate against people if they had a pre-existing illness or conditions, and they required them to cover what they called essential benefits.
And what's the issue for Republicans who hate Obamacare, right?
Right. So the issue for Republicans were a few things, one of which was in the beginning there was an individual mandate, a law requiring people to get insurance. And I think Republicans generally hate anything that requires people to do something like that. That eventually went away. So that was part of it. And Obamacare also included a provision encouraging the states to expand their Medicaid programs, which cover low-income people, and it tried to give them financial incentives to do that. And again, I think the Republican Party saw that as more bureaucracy and expansion of government.
And Donald Trump said in his last presidency that he's going to scrap Obamacare, didn't do it, made significant changes to it. What do you think this time round, Rina?
Well, those exchanges that Joyce just referenced that created access for people in rural communities, for example, like the one I grew up in rural southern West Virginia, those exchanges are good because they allowed people that usually could not afford care to get some form of insurance. And that still exists today and actually is a good thing. And so in some ways, Republicans understand that they're on the losing side of the issue if they bring it up again. So that's why they're coming at health from a different angle this time. With the nomination of Robert F. Kennedy Jr. to be head of HHS and Dr. Mehmet Oz to be head of the Centers for Medicare and Medicaid, we are looking at 2 figures that could be really transformative in American health. On the policy front, I don't know so much, but Robert F. Kennedy Jr., what he's done is brought up so many different things about the influence of big pharmaceuticals in our daily life, additives and chemicals that are part of our food. So holding big corporations to task and getting those out of our food. And of course, the topic of vaccinations, which is hotly contested.
Right, let's talk about that, Joyce. So he is a controversial pick, one of many controversial cabinet picks from Donald Trump. What are the main issues that people are having a problem with?
Well, certainly, as Rina mentioned, his stance on vaccines is the biggest issue. I think I've been hearing more outcry from the public health community about, even though he says he's not against vaccines, he's just questioning the evidence for some of them.
But there is a lot of evidence. There's a lot of research, which is why none of our kids can go to summer camp without health forms showing that they have been vaccinated. It's woven into the fabric of this society. So what impact will someone like that have on that?
Well, I think that's a problem. I think vaccination rates are already dropping, including both for school children where there are exceptions and you're allowed to opt out of having vaccines, and also just for other vaccines, the COVID vaccine, HPV. People are now questioning whether they should get them and whether they would be harmful.
One big thing about Robert F. Kennedy Jr. is truly that his most recent public statement is saying that he won't ban any of the available vaccinations that are currently available to all Americans, right? But it becomes an issue even if he doesn't do that because the public health sentiment, people essentially thinking that they have that bodily autonomy, which he also talks about. You know, the Republican attitude is don't tread on me, right? It's a conservative sense that government should not get too big in order to tell you what to do with your body, which is quite rich in today's Republican Party because, again, they want to do that when it comes to reproductive access and abortions. But back to how Robert F. Kennedy Jr. does this, I think is very dangerous because it promulgates the message that it's okay to go unvaccinated when we have decades of evidence showing us that vaccinations have helped keep our society healthy and thriving. And so I really hope that there's a social and public campaign that pushes back on this dangerous rhetoric.
Yeah, and health by its very nature, as we've discussed throughout this show, is so deeply personal. And there are so many stories out there of people being denied drugs, of people drowning in debt. Joyce, is there anything that's on the horizon that might make things better? Or is this just something that people accept?
Yeah. As far as any big change in the healthcare system, I'm not seeing anything coming anytime soon. The one thing that might continue is President Biden, when he started doing price negotiation for Medicare, drugs for Medicare beneficiaries. And so Donald Trump has made remarks indicating that he actually favors some price controls in that area. I think that may keep going. But anything else about changing the system, I just don't see it because the pharmaceutical companies and the insurance companies are very influential and powerful. They lobby the members of the Congress, and I don't see that changing anytime soon.
Rina, is it put up and shut up?
It's certainly not going to reverse course as we know it. The lobbying impact on these lawmakers, a lot of their reelection campaigns are funded by these very same companies that are determining whether some of us get care or not if we're in a tenuous situation. Look, I'll say this, I'm the daughter of a physician, wife of one, and sister of two medical students. So I'd be remiss if I didn't mention how much I have seen private medicine change in this country. Private practice almost is so difficult to keep alive if you're a physician, whether in a small town or in an urban area. It is really hard to keep afloat because of the direction that medicine is going in this country. It is socializing in some ways. Is that a terrible thing? I don't think so on some level. But on the other hand, you do have to worry about the longer term impact. And I do think this is someplace the Trump administration will insert itself at some point, maybe 2 years from now or not. I don't know. But keeping American medicine competitive and innovative does include keeping some of these corporations at the table. Does it mean American healthcare lobby should have as strong a grip as they do on the American lawmaker? Absolutely not, but that's what our system's designed to do. At the end of the day, people are talking about Turkey, for example, being a medical tourism destination. The U.S. is being talked about less in that way. So again, that's why I expect the Trump administration to step in, because they want to make America great on the world stage.
Right, and a lot of these moves related to healthcare, Joyce, would be very populist moves. When you look at what Biden did, one of his last minute things of this whole law to bar medical debts being reflected in credit reports, they're almost daring Trump. Are you going to keep this in place? How do you see that one panning out?
I don't see that as something he would touch, at least immediately. And I want to say something about that because it certainly is a good thing in many people's view that that's been done. And having the medical debt on your credit report obviously hurts your ability to get a mortgage, rent an apartment, get a credit card. And so not having that there is a good thing, but it doesn't erase the debt. And that problem persists because of our uniquely American healthcare system and the fact that we don't have any sort of nationalized insurance that everyone can fall back on.
And Rina, just a last broader question to you. Obviously, in the building behind us, there's a lot going on right now. Healthcare is one of the issues. It seems at the moment there are other issues that are taking precedence, pardoning rioters, the crusade against wokeness. What have you made of the first few days?
I think certainly I have seen healthcare take a backseat, actually, because it seems like the immigration issue is so hot right now for this administration, where they need to capture a win on that front. But that this ending wokeness sentiment that they seem to really put front and center will extend out into departments such as education and other places, also maybe into healthcare in some ways. We heard the president say on his inaugural day in 3 different speeches allude to 2 genders only. And so we've got to wonder about how fellow Americans feel who don't categorize themselves or see themselves fitting in one box or the other, how they themselves will feel free, equal, and just in American society when this administration is taking what seems like pretty rapid and unusual measures to turn back the clock on a lot of equality measures, again, that could impact healthcare very intimately.
Okay, Rina, Joyce, thank you both so much for your time. So much change lies ahead. We'll do our best to keep track of it all. Do join us next time on Inside America. Thanks for watching.